I'm Marianne Andrews, and the career that I looked into was a psychiatric social worker. And this does require a master's degree. Um, it's a very demanding and stressful job because you're dealing with uh, people that have mental health or addiction issues, and the there's a lot of paperwork to do, and it's a very fast-paced occupation, and it can be hard to see people in that are really suffering. That can be really draining, and the clientele can be unpredictable and dangerous as well, um, and it can be frustrating that you can't get their needs met because services just aren't available. So those are the bad things first. Now the good news. It's really rewarding and it's really needed. Um, the typical job tasks would be conducting psychosocial assessments, treating, planning, group and individual clinics service, case coordination, and documentation. Um, they do a lot of they can provide peer and group therapy, work with the families, um, work on discharge plans. They can be employed at psychiatric hospitals where they do psychosocial assessments and provide therapies. Social workers may, for example, employ eye movement desensitization and reprocessing with trauma survivors, and they frequently are in contact with the patient's family members, and they meet with other healthcare professionals to discuss the patient's care. If the patient is involved in any legal proceedings, the social worker may have a role in information gathering and reporting back to the court. They can also be employed in outpatient centers, working with juveniles or adults, and in governmental agencies and residential care facilities. So lot of options and opportunities. The BLS projected that this particular career field would grow by about 31% in the decade from 2010 to 2020. So the starting salary range is about $42,000 a year, but once you have experience, it can go up quite a bit, anywhere from $62,000 to $110,000, depending on where you work. This is a job where you help mental health patients and their families in a similar way to counselors and psychologists. So you assess them, you develop individualized plans, and coordinate them with outside services as well, not just the ones within the place where you work, but there might be a county program that could help them, that you could connect them to. So it's a very rewarding job, but also a difficult job. It's family friendly in that if you work in a hospital, you can work any shift, and they have part-time jobs as well as full-time. But it would be family unfriendly in that it would be so stressful, and establishing yourself would have to be full-time. And so that's the career I looked into, psychiatric social worker. Thank you.